Hello and welcome to Workers Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So let's get started. Welcome back to Season 2, Episode 12 of Workers Comp Unwrapped. With me is Aisha, who has 15 years of experience in the workers' comp world. Today we're talking about the unique challenges chiropractors face in workers' comp.
Absolutely.
From billing RFAs to addressing medical necessity objections. And it's so important we discuss this because chiropractors play such a crucial role in getting injured workers back on their feet. But the system can sometimes feel like an uphill battle.
It can. It really can.
So imagine this for our listeners out there. You're a chiropractor. You have a patient who's clearly benefiting from your care. And then all of a sudden the insurance company starts questioning every single thing.
Absolutely.
They want more documentation. They throw around jargon. And sometimes they even go so far as to deny claims. It's enough to make anyone's head spin.
It can be very, very frustrating.
So let's unpack some of those reasons.
Sure.
Because understanding the why can help chiropractors figure out how to play the game strategically.
Totally.
So what are some of those biggest hurdles that chiropractors face when it comes to billing?
Well, I think sometimes there's a certain level of skepticism around chiropractic care, especially in the context of workers' comp. And so some insurers may question the necessity of treatments, especially for chronic conditions, if the documentation isn't strong enough. So they really want to see clear evidence that the treatment is helping that worker improve and ultimately return to work.
So it's not just enough to provide excellent care.
No.
Chiropractors almost need to become masters of documentation.
Absolutely.
Like they're building a legal case for every single treatment.
That's a really great way to put it, because every progress note, every test result becomes a piece of evidence supporting the medical necessity of the care that you're providing. And I think that leads us into another one of the major hurdles, and that is navigating the world of RFAs and utilization reviews.
Yes, the infamous RFAs, I'm sure.
Yes.
A lot of our listeners out there are familiar with that process.
Yes, very much so.
What does that look like in the real world?
So many chiropractors are constantly submitting RFAs for a variety of services. And even when those services seem essential, they're often met with a utilization review. So that basically means the insurer is diving deep into the case, really scrutinizing every detail. And they're using what's called the Medical Treatment Utilization Schedule, or the MTUS, as their guide to determine if the treatment is truly medically necessary.
So chiropractors need to basically become fluent in MTUS to succeed in this world.
Absolutely. And it's not just about knowing the guidelines, but it's really about understanding how they're applied and interpreted. Because sometimes even a seemingly straightforward treatment can be denied if the insurer doesn't believe it aligns with that MTUS.
So it sounds incredibly frustrating when the treatment's in a patient's best interest.
It can be very disheartening. And I think that's why it's so important to not only document everything meticulously, but also do so with that MTUS in mind. For example, if you're recommending spinal manipulation therapy, you need to be very specific in your RFA, outlining the type of manipulation, the frequency, the duration, and directly connecting it to those MTUS guidelines. So instead of just saying spinal manipulation, be very specific and say something like spinal manipulation therapy, 2 sessions per week for 4 weeks, consistent with MTUS guidelines for acute low back pain.
So it sounds like precision is key.
Absolutely.
You're not just treating the patient. You're almost anticipating the insurer's potential questions.
Totally.
And addressing them head on in your documentation. Now, let's be honest. Even with a perfectly crafted RFA and impeccable documentation, things don't always go smoothly.
That's right.
So let's talk about when things do go wrong. What are some common roadblocks that chiropractors might face even when they've dotted all their I's and crossed all their T's?
Well, one of the biggest headaches I see is delayed reimbursements.
Yeah.
And this can happen for various reasons.
Yeah.
Sometimes there are disputes over service codes. Sometimes there's missing documentation. And sometimes it's just simply administrative backlogs within the workers' comp system.
Right.
But it can be a major strain on a practice's cash flow.
I can only imagine, especially for smaller practices that are working under tighter margins.
For sure.
So speaking of systems, you mentioned earlier that
Yes.
chiropractors need to become masters of documentation.
Right.
What are some practical steps that they can take to strengthen their documentation game and avoid those dreaded denials?
Okay, so think of your initial evaluation as setting the stage. It needs to be incredibly thorough.
Okay.
Not just ticking boxes, but really telling that patient's story in a way that's both comprehensive and compelling for the insurer. That means detailing the injury history, capturing their current functional limitations, and then outlining a clear initial treatment plan.
So you're painting this vivid picture
Yes.
for the insurer, showing them the impact of that injury on the worker's life.
Yeah.
And then with each progress note,
Yes.
it's about moving beyond those subjective statements like the patient is feeling better.
Right.
And actually providing
Yeah.
quantifiable evidence of their improvement.
That's a great point.
So numbers are king in this game.
Absolutely.
Okay.
Things like range of motion measurements, pain scales, scores on functional assessments, those provide concrete data points that insurers can't easily dispute.
So it's like you're speaking their language.
Exactly.
It's about showing, not just telling.
I love that.
Right. And what about using standardized outcome measures?
Those are so valuable.
Right. Those are really valuable tools
Yes.
in workers' comp cases.
Absolutely. So tools like the Oswestry Disability Index or the Neck Disability Index,
Okay.
they provide standardized scores that allow insurers to track progress over time.
Okay.
And it just adds another level of objectivity to your documentation that can really strengthen your case for continued care.
Okay. So we've got detailed initial evaluations.
Yes.
Objective progress notes the use of standardized outcome measures. What else should chiropractors be keeping in mind?
Another really key aspect is having a clear discharge plan.
Okay.
This shows the insurer that you're not just continuing treatment indefinitely,
Right.
but you have a strategy for concluding care or transitioning to maintenance based on specific criteria
Right.
and the patient's progress. So it really demonstrates a thoughtful and responsible approach to treatment.
So you're almost anticipating those insurer concerns again
Yeah,
and proactively addressing them in your documentation.
exactly. You're essentially taking away their ammunition for denying claims
Yeah.
by showcasing your thoroughness and expertise.
So I know we've talked a lot about preventing denials.
Yes.
So let's be realistic.
Right.
They're going to happen sometimes, even with the best documentation in the world.
For sure.
So what are some common objections that chiropractors face?
Okay.
And how can they effectively address them?
Okay. So one of the most frequent objections I see is the denial of extended care. So for example, an insurer might deny continued chiropractic treatment after 6 weeks, claiming that there isn't sufficient evidence to justify it.
And I'm sure that's so frustrating
It can be very frustrating.
for both the chiropractor and the patient,
Absolutely.
especially when they feel like that care is still needed.
Right, but here's the thing. You have the right to appeal that decision.
Okay.
And in these situations, it's really all about going back to your documentation and making sure that it paints a very clear picture of why that continued care is medically necessary.
So how would a chiropractor go about building that case for appeal?
Okay, so instead of relying solely on subjective reports from the patient, present objective findings from your progress notes.
Yeah.
Highlight those range of motion measurements, those pain scales,
Right.
scores on functional assessments that demonstrate ongoing improvement
Okay.
or the potential for setbacks
Yeah.
if care is discontinued.
So it's almost like you're presenting new evidence to a judge
Yes,
to try to overturn a previous ruling.
exactly.
Right.
That's a really great analogy.
Nice.
And don't be afraid to even go beyond those basic progress notes.
Okay.
Include a supplemental letter, really explaining that rationale for continued care,
Okay.
connecting it back to the specific requirements of the MTUS
Right.
for that particular condition.
Okay.
So for example, if the insurer is denying treatment based on those acute phase guidelines, but the patient is clearly transitioning into a chronic phase, you can cite those MTUS recommendations for managing chronic conditions to really support your case.
So it's about knowing that MTUS inside and out
Total.
and being able to use it strategically to advocate for your patients.
Absolutely.
Now, another helpful strategy for appeals is to include what's called a tapering plan.
Yes.
Now, what does that look like?
So this demonstrates to the insurer that you're not proposing indefinite treatment, but a gradual reduction in frequency as the patient improves. So you're essentially saying, I am committed to helping this patient achieve maximum recovery, and here's my plan for getting them there.
So you're showing the insurer that you're being responsible and thoughtful about the course of care. Not just trying to rack up unnecessary visits.
Absolutely.
Now, besides denials of extended care, what are some other common objections that chiropractors might encounter?
Another frequent challenge is getting treatments approved that aren't explicitly covered by the MTUS. So, for example, some newer therapies or modalities might not be specifically mentioned in the guidelines, and that can lead to denials.
So how do you navigate that gray area? Does it mean those treatments are automatically off the table?
Not necessarily. The key here is to provide robust evidence from other reputable sources to support your treatment plan.
So like what?
Think peer-reviewed studies, clinical guidelines from professional associations like the American Chiropractic Association, or even expert opinions that really demonstrate the efficacy and appropriateness of that treatment.
So you're going above and beyond that MTUS and building a stronger case based on scientific evidence and clinical expertise?
Exactly. You're essentially saying to the insurer, look, I know this treatment isn't explicitly listed, but here's why it's still the best course of action for this patient. Based on the latest research and my professional judgment.
Awesome.
Yeah. It's about being proactive and showing the insurer that you're not just blindly following a protocol, but you're actually applying your knowledge and expertise to tailor that treatment plan to that individual patient.
And speaking of empowering, we touched on technology earlier. I'm curious to kind of dive a little bit deeper into that.
Sure.
What are some of the tech advancements that are transforming the landscape of workers' comp for chiropractors?
Well, there are some game changers out there. I mean, telehealth, for example, is revolutionizing follow-up appointments and consultations, especially for patients who face challenges with transportation or mobility. So imagine a worker with a back injury who struggles to drive or sit for extended periods. Telehealth allows them to continue receiving care without those added burdens.
Which makes so much sense as we see this growing focus on patient-centered care and removing barriers to access.
Absolutely.
I imagine it's incredibly beneficial as well for rural areas where access to specialists might be limited. Now, what about...
And then there's also the world of electronic documentation and billing systems. These platforms are streamlining everything, from submitting RFAs to tracking claims, reducing errors, and even providing real-time insights into your practice's financial health.
So it's not just about being a skilled chiropractor. It's about becoming tech-savvy as well.
It's definitely an advantage in today's world. Think about it this way. Every hour that you spend wrestling with paperwork is an hour that you're not spending with patients or focusing on growing your practice. So these technologies can really free up your time and mental energy.
And I've also heard that some of these systems can actually analyze your billing data and identify areas for improvement or potential red flags that could trigger an audit.
That's right.
So tell me a little bit more about that.
Yeah, so some of the more advanced systems actually use algorithms to identify patterns in your billing practices, and they can alert you to any inconsistencies or areas that might raise eyebrows with insurers.
So it's almost like having a virtual compliance officer on your team.
Exactly.
Which is incredibly valuable.
It is.
Especially as the regulations surrounding workers' comp are constantly evolving.
It takes a lot of the guesswork out of it. And really helps you stay ahead of the curve.
So beyond technology, there's another critical element to success in workers' comp. And that's mindset.
Mindset is huge.
So let's talk about that. What's the mental game that chiropractors need to master to thrive in this world?
You know, it's so easy to get bogged down by the challenges and feel like you're constantly fighting an uphill battle. But it's so essential to remember your purpose.
Okay.
The positive impact that you're having on your patients' lives.
Yeah.
You're helping them regain their mobility, manage their pain, and ultimately return to work in their everyday activities.
So it's about remembering the human side of things.
Absolutely.
The real people behind all the
Yeah.
paperwork.
The real people whose lives are being touched
Yeah.
by your care.
And along with that, cultivating a growth mindset.
Yes.
So instead of seeing the complexities of workers' comp as these roadblocks,
Right.
viewing them as opportunities to learn and grow
Absolutely.
and refine your skill.
It's about becoming a master negotiator,
Yeah.
a persuasive communicator, and a fierce advocate for your patients.
So turning those I can't moments into I will learn how moments.
I love that.
So for those chiropractors feeling overwhelmed or discouraged right now,
Yeah.
what advice would you give them?
You know, first remember that you're not alone.
Okay.
Find other chiropractors who understand what you're going through. Connect with them, share your experiences, and learn from each other.
So it's like having a support group
Exactly.
or workers' comp warriors.
Yes.
And along with that, prioritizing continuing education
Absolutely.
because this landscape is constantly evolving.
It is.
So staying current
Yes.
on the latest regulations, coding changes best practices
Right.
is essential.
There are so many resources out there.
Yeah.
From online courses to conferences to keep you sharp and informed.
So it's not just about what you learned in chiropractic school.
No.
It's about being a lifelong learner in this field.
It is. It's an investment in yourself and your practice.
Okay, and finally.
And finally, remember that your expertise is invaluable. You have a unique skill set that can truly transform people's lives.
Yeah.
So never underestimate the power of what you do.
Right.
And never be afraid to advocate for your patients, your practice, and the incredible potential of chiropractic care.
Now, I know we've covered a lot of theoretical ground here, but do you have any real-world examples
Yes.
of how these strategies have played out?
Yeah, absolutely. So I recently worked with a chiropractor who was struggling to get approval for ongoing maintenance care
Okay.
for a patient who had recovered from a work-related shoulder injury.
Okay.
The insurer argued that the initial treatment phase was sufficient and denied the request for continued care.
And I'm sure that's something that a lot of chiropractors are dealing with
Very common.
because they know the patient needs the care
Right.
to maintain their progress and prevent future flare-ups.
Exactly. But convincing that insurer can feel impossible sometimes.
So how did they approach this?
Well, this chiropractor knew they needed to provide concrete evidence to support their recommendation for continued care.
Okay.
So they went back and reviewed their documentation. They highlighted specific findings from the patient's progress notes,
Okay.
showing that when the frequency of adjustments was reduced,
Yeah.
the patient experienced increased pain and stiffness, which impacted their ability to perform their job duties.
So they were able to show that direct correlation
Yes,
between the reduced care and a decline in their functional capacity.
exactly.
Okay.
And to further strengthen their case, they included a supplemental report explaining how periodic maintenance care
Right.
aligned with those MTUS guidelines for managing chronic shoulder conditions.
Oh.
So they actually cited specific sections of the MTUS that supported their recommendation.
They used the insurer's playbook
Yes.
against them.
Love it.
Okay.
And to really seal the deal,
Okay.
they included objective measurements from the patient's previous maintenance visits, showing a clear pattern of reduced pain levels and improved range of motion when receiving those regular adjustments.
So it was a combination of connecting the patient's subjective experience with those objective findings.
Yes.
And aligning those findings
Yes.
with those MTUS guidelines.
You got it.
And what happened?
And it worked.
Yeah.
The insurer ended up approving bi-weekly maintenance visits
That's amazing.
for an additional 3 months. So not only did this help the patient maintain their progress, but it also prevented potential setbacks
Right.
that could have led to a recurrence of their injury and further lost work time.
That's a fantastic example
It is.
of how persistence and detailed documentation and a deep understanding of the MTUS can really lead to a win-win
Absolutely.
for both the patient and the chiropractor.
For everybody.
Yeah.
It really highlights the importance of becoming an expert.
Yeah.
Not just in chiropractic care, but in the nuances of workers' comp as well.
So for all the chiropractors out there listening,
Yes.
what are some of those key takeaways from our discussion today?
Okay, let's break it down into some actionable steps.
Okay.
First and foremost, master the art of documentation.
Okay.
Think of every progress note
Yeah.
as a legal document
Okay.
that needs to clearly articulate the medical necessity of your care. Be specific, use objective measurements, and connect your treatment plan to those MTUS guidelines whenever possible.
So show, don't tell.
Exactly.
All right.
Second, embrace technology.
Okay.
Explore the tools and platforms that can streamline your billing processes,
Right.
reduce errors, and provide valuable insights into your practice's performance.
Working smarter, not harder.
Exactly.
Okay, what else?
And then advocate for your patients and yourself.
Okay.
Don't be afraid to appeal denials, challenge questionable interpretations of the MTUS, and stand firm in your clinical judgment.
Yeah.
Remember, you are a valuable asset to that workers' comp system.
Right.
And your expertise deserves to be recognized and compensated fairly.
What a powerful message of empowerment.
Thank you.
Now, as we start to wrap up this episode,
Yes.
is there anything else you want to leave our listeners with? Any final thoughts, any pearls of wisdom?
Yeah, I think a lot of times people forget that, especially when you're dealing with these complex cases, it can feel very transactional, but at the end of the day, it's really about those human connections.
Right, and it's easy to lose sight of that
It is.
when you're dealing with all the paperwork and the jargon.
Absolutely.
So going back to that why
Yes.
can really help center yourself and fuel that passion.
Totally.
Now, before we wrap up,
Yeah.
I'd love to touch on a point you made earlier about the importance of mindset.
Yes.
It's so easy to feel overwhelmed
Oh, yeah.
and even defeated by this system.
It can be really tough.
What advice would you give to chiropractors who are struggling to stay positive
Okay.
and motivated?
First and foremost, remember why you chose this profession. You're making a real difference in people's lives. You're helping them heal, regain function, and get back to doing the things that they love.
So finding that spark of inspiration
Yes.
amidst all the paperwork and the red tape.
Absolutely.
What else?
And remember, knowledge is power. The more you understand the intricacies of workers' comp, the more confident and empowered you'll feel.
So invest in that continuing education. Stay updated on the latest regulations. Never stop learning.
It's an ongoing journey.
And it's a journey you don't have to take alone.
That's right.
Connect with other chiropractors, build a support network, share your experiences.
There's strength in community and collective wisdom.
This has been such a valuable conversation.
Thank you.
Thank you so much for sharing your expertise with us today.
My pleasure. I hope it's empowered our listeners to approach workers' comp with more confidence and a sense of optimism.
Now, for our listeners out there, we'd love to leave you with a thought-provoking question to ponder. What if there was a way to use artificial intelligence to help chiropractors proactively address potential objections from insurers? Could AI analyze patient data and MTUS guidelines to suggest the most effective documentation strategies, or even predict the likelihood of an RFA being approved? What role do you think AI could play in streamlining this process and making it more efficient and less stressful for everyone involved?
That's a fascinating question that really opens up a whole new realm of possibilities. It really highlights that potential for innovation within workers' comp and how technology might help bridge that gap between providing exceptional care and navigating the complexities of the system.
It's exciting to think about the future and all the positive change within this field. So thank you again for joining us today.
It's been my pleasure.
And to all our listeners, thank you for tuning into this episode of Workers Comp Unwrapped. We hope you found it informative and empowering. Remember, you are champions of recovery, and your expertise is invaluable. Keep up the great work. Thank you for listening to Workers Comp Unwrapped. If you found value in today's episode, share it with your fellow medical providers and healthcare specialists. For more information, contact us at lena.klein@medicallienmgt.com or visit our website, medicallienmgt.com.